Hello, and welcome to the Penguin Patient Pathway training presentation. The following training presentation will take you through the processes involved in identifying, consenting, and randomising patients to Penguin before they have their surgery. It's important to develop a patient pathway that will allow you to efficiently recruit patients to the trial. The next presentation will focus on the activities and assessments required after the patient has received their surgery and are in the follow-up stage of the trial. For the trial to be successful, it is important to determine how patients will be identified as potential trial participants. This process can be multidisciplinary, including your department and other departments within your site. Identifying patients can therefore occur on a ward, in an emergency department, or an outpatient clinic. Patients should only be approached if they are likely to meet the eligibility criteria for the trial, which is outlined below. Once a patient has been identified, it is important to adequately inform patients about the trial, to comply with good clinical practice guidelines, and to ensure they are well informed on all aspects of the trial. Therefore, patients should be provided with a patient information sheet, have the trial explained to them in lay, simple language by the principal investigator, medically trained doctor or research nurse, have explained to them the potential benefits and risks of participation in the trial, and answer any potential trial-related questions the patient may have about any aspect of the trial. For example, the trial interventions that are being used, what the follow-up procedures would entail, and what would happen if they wanted to withdraw from the trial. Before consent is obtained, a member of the research team must discuss the consent procedure with the patient. They should explain consent is being sought for inclusion in a randomised controlled trial. This is in addition to the operative consent they provide for the surgical procedure. That the trial will investigate 2 separate interventions aiming to reduce surgical site infection and pneumonia after surgery. The interventions will be allocated at random, and there is an equal chance of receiving different interventions. Participation is voluntary and they are free to withdraw at any time point. That there will be follow-up appointments required at 30 days after their initial surgery, and that they may be entitled to some reimbursement. And this can be for travel, expenses, time, missed work, etc. It's important to use the latest version of the informed consent form, and all of the sections must be completed. This includes the patient's initials or thumbprint for each of the statements on the informed consent form, and the patient's name, signature or thumbprint, and date the form is completed. Consent must be witnessed by a member of the research team before any trial-related procedures are conducted. The member of the research team will co-sign the informed consent form. This person should be delegated the responsibility of taking consent on the site signature and delegation log. Usually this will be the principal investigator, a medically trained doctor, or a research nurse, where research nurses are permitted to obtain consent. The date the patient and research staff sign the informed consent form must be the same to evidence the staff member witnessed the patient completing the informed consent form. In countries that allow children to participate in clinical trials, a parent or guardian must provide assent permission for the child's participation in the trial. A copy of the informed consent form will be given to the participants. One will be filed in the medical notes, and the original stored in the investigator site file. Altogether, there should be 3 separate copies of the informed consent form. Following slides will focus on the process involved in randomising patients and the administration of the trial interventions before and during surgery. When a patient has consented to the trial, you must then allocate a trial number for this patient. Trial number stickers will be provided during site setup. Before performing the randomisation, select the next set of trial number stickers from the investigator site file. These stickers can then be added to trial documents when required. After allocating a trial number, the next step is to complete the randomisation notepad before the online randomisation can be performed. The first section of the form can be completed by any member of the research team. Please confirm the patient's eligibility status by ticking the appropriate boxes on the form. If any of the shaded boxes are ticked, then the patient is not eligible for Penguin and they cannot be randomised to the trial. In addition, you must also complete the timing of surgery and indication for surgery, because this is important information that is used in the randomisation process. It is the responsibility of the principal investigator or medically trained doctor to confirm that a patient is eligible and that the information on the paper randomisation notepad is accurate. By signing the confirmation of eligibility section, the investigator is confirming the patient is eligible for the trial and that they meet the inclusion criteria and did not meet any of the exclusion criteria. When the paper randomisation notepad has required information to randomise the patient, this can now be added onto the Penguin trial database, where the patient will be randomised to a trial intervention. The database can be accessed following the link in this slide. When a treatment allocation has been assigned, enter this information onto the randomisation notepad to complete the form. The patient is now ready to receive the allocated interventions. Patients will be randomised to either having 0.2% chlorhexidine digluconate mouthwash or no mouthwash. If the patient is randomised to the mouthwash intervention, they receive the mouthwash within the 30 minutes immediately before the induction of anaesthesia. 2 30-second mouthwashes of 15 ml of 0.2% chlorhexidine digluconate will be administered. This can be performed in the anaesthetic and/or operating room. This must be observed by the anaesthetic provider to confirm adherence to the intervention. A clean or disposable cup should be used for each patient too. Patients will also be randomised to either liberal or restrictive oxygen during surgery. Liberal concentration of 80 to 100% fraction of inspired oxygen can be delivered from the induction of anaesthesia and throughout surgery. For the restrictive intervention, anaesthesia will be delivered with a fraction of inspired oxygen between 21 and 35%. Higher concentrations up to 100% will be used at the discretion of the anaesthetic provider during the induction and cessation of anaesthesia, and if clinically indicated at other times of the treatment of hypoxia. Research staff will be provided with additional training on how to administer the trial interventions. The administration of the mouthwash can be performed by the investigator, medically trained doctor, or research nurse. For oxygen delivery, must be administered by the investigator, medically trained doctor, or anaesthetic technician. Members of the research team who administered the intervention must complete the intraoperative and intervention adherence case report forms. The discharge, follow-up and 30-day follow-up case report forms must not be completed by a member of the team who administered the trial interventions. Trial data will be recorded on case report forms. Penguin has 2 case report form booklets for adult and paediatric patients. It is important to use the correct one because information on each of these booklets differs. Case report forms contained in these booklets are randomisation notepad, baseline form, intraoperative form, and intervention adherence form. Additionally, the trial has standalone case report forms which can be used for adults and paediatric patients. These forms are follow-up at discharge, 30-day follow-up, trial exits, and serious adverse events. CRFs should be separated into patient-specific Penguin files and stored in a secure location. I will now discuss what information is collected on the forms contained within the case report form booklet. Baseline CRF captures data on health status before surgery and records the COVID-19 status of the patient. The intraoperative CRS captures data on the anaesthetic procedure and techniques used, type of surgery performed, whether the WHO surgical safety checklist has been used, oxygen delivery throughout surgery, and any adverse events that have been captured. The intervention adherence CRF captures data on whether the patient received the trial intervention. This form should be completed early after surgery, and the CRF should be completed using the information available from patient hospital notes and the anaesthetic charts or its equivalent. Surgeons' operative notes must not contain information about the interventions unless this is requested by a research ethics committee. A trial exit CRF should be completed if abdominal surgery is not performed, unable to collect 30-day follow-up data, for example, patient did not attend or cannot contact patient. However, every effort should be made to contact and follow up the patient at the 30-day time point. This form should be used as a last resort. And if there's a withdrawal of consent from the patient. Once complete, the CRF should be sent to the local coordinating centre. So it's important to emphasise that participation in the Penguin trial is completely voluntary, and that participants should be made aware of this at the time of consent, and that they are free to discontinue trial at any time point. The types of discontinuation can be found in the Penguin protocol. Please refer to this for further information. All trial data should be entered onto the REDCap database, which can be found at the following web address. REDCap accounts will be issued during site setup for each person working on the trial. More information will be provided through user manuals and through the data management training. Thank you for listening to the training on the patient pathway. The next training module will focus on patient follow-up.